So I think the first thing to say is that acne is a disorder of the hair follicles. Now, we have hair follicles all over our body, but not all of them grow hair, obviously. But all of them have, as part of their structure, a sebaceous gland, which produces a natural oil called sebum. Now, these glands are sensitive to hormones and can produce too much oil or sebum, which is why acne is more common in teenagers and young adults, particularly after the hormonal surge of puberty. Now, this doesn't mean that your hormone levels are necessarily abnormal. It just means that these glands are very sensitive to the hormones that are already in your system. The second part of acne is that as the old skin is shed from the hair follicles, the follicles actually get blocked, which is what causes blackheads and whiteheads. And I would say the final component to acne is that all of the above create an environment where a bacteria that lives on all of our skin called C. acnes can grow and cause inflammation, redness, and pus-filled spots in the skin. So you can imagine there's lots of factors that contribute towards acne, and the treatment of it reflects addressing each of those factors. So some of the most common things that I see that can make acne worse are firstly overuse of cosmetic and cosmeceutical products. Now, I've seen patients who apply a huge number of products to their skin as part of their day-to-day routine because they're all marketed to help acne. But actually, I think applying too many products to the skin can worsen the condition and lead to blocking of the pores. The second thing is use of oils on the skin. I think things like tea tree oil and coconut oil, because of their oil oily consistency, they block the pores, and that in itself can worsen acne. Also, certain medications can worsen acne, particularly certain contraceptive pills that are primarily progesterone based, as well as other kind of hormone based treatments like steroids or testosterone, which can be used as performance enhancing treatments for athletes in particular. I often get asked about diet. Now, diet's an interesting one. Some people do find that certain foods worsen their acne, particularly sugary diets, particularly there's also some evidence for high milk or dairy product consumption. But the research linking diet and acne at the moment is not conclusive. So I don't routinely recommend my patients restrict their diet in order to treat their acne. And finally, I would say that certain underlying conditions, in particular polycystic ovary syndrome, can make it more likely for you to develop stubborn acne. So most people experience acne at some point in their lives. And if you look at kind of studies from Western countries, it's reported that up to 95% of teenagers and young adults experience acne at some point. But obviously, most of the time it's mild and it passes and doesn't require much treatment. There is, unfortunately, no way to prevent acne, but having a good skincare routine and avoiding the factors that can trigger and aggravate acne that I mentioned earlier can help. In terms of treatment, yes, absolutely. Acne can be treated. And for me, the key is to treat it early before it gets severe enough that it leaves behind scarring, which is much more difficult to treat. I use a range of treatment for my patients, and these can include topical therapies such as retinoids and benzoyl peroxide, tablet antibiotics, hormone controlling therapies like contraceptive pills or a tablet called spironolactone, as well as vitamin A based drugs like isotretinoin, or the brand name is Roaccutane or Accutane. And I sometimes use a combination of these therapies to complement each other. Now, which treatment I recommend depends on the type of acne and the severity of acne you have. If it's mostly red spots or pus spots or blackheads or whiteheads, some people have kind of deeper marble-like nodules and cysts. Or is it a combination of these? It's important to determine this and make a tailored treatment plan for each individual patient. Now, acne is extremely common, as I mentioned earlier. If you look at the data, about 85% of patients with acne are kind of between the ages of 12 and 24. And then between the ages of 24 and 34, it drops to around 8% of patients. And 35 to 44 is about 3% of patients. So as you get older, the likelihood of having acne reduces. But what we've seen in younger patients is that it's more common in men. But in adulthood, acne is actually more common in women. The other thing to say is that acne can affect all skin types, from fairer skin to darker skin. And one of the problems I see, particularly in darker skin patients, is that acne can leave post-inflammatory hyperpigmentation, which is where acne leaves behind dark marks, which can take a long time to go away. And as dermatologists, we can certainly help with the treatment of that. So please, please don't pop your spots. As satisfying as it might be, you're risking causing scarring in the skin. And the focus should be on the medical treatment of your acne. And I think while we're on this topic, there are a few other common misconceptions. Firstly, that acne is caused by dirty skin or poor hygiene, which is simply not true, as acne is an underlying inflammatory skin condition. The other common myths that I often hear are that toothpaste can help acne, that acne is infectious, and that exfoliating your skin aggressively can clear the acne away. And all of these are untrue.